Okay, good afternoon, everybody. Thank you all so much for coming to today's session. I've heard conflicting reports on the weather, so thanks for either braving the rain or for coming in despite it being beautiful outside. But either way, thanks so much for coming to this session on population health and environment programs in Nepal. We're really looking forward to hearing from both Jon and Rishi. My name is Gib Clark. I am the Senior Program Associate here with our Environmental Change and Security Program. I'm also on our Global Health Initiative, where we focus on maternal health, health financing, and post-disaster, post-conflict health. So we hope you can join us for future events on population health and environment, as well as on these other issues. Before we get started, I see some familiar faces, but I do want to just let you know a little bit about where you're sitting. The Woodrow Wilson Center was founded in 1968 by an act of Congress as the living memorial to President Wilson, as he was our only president to have had a PhD. For better or for worse, the idea was to bring together the worlds of ideas and the world of policy, the world of practice, and in our events we aim to do that. This meeting is part of our sort of continual series on population health and environment, building the foundation for the next 10 years, where we're taking a long-range systematic look at PHE issues, but also highlighting case studies and research and the future of the field. We've not focused much or hardly at all, in fact, in this series on this part of the world. And I myself have to confess that I've never been to Nepal. So I'm really looking forward to hearing both about the context of what's going on in Nepal and why PHE may be a good solution to help confront these problems. And one other thing I left out, I'd really like to also thank the Wilson Center's Asia program, which helped us in putting this event together. So as we try to look at the context and the situation for PHE in Nepal, I don't think we could have gotten two more appropriate people. Jon Miceler will speak about WWF's work in the Terai Landscape specifically, providing an overview of WWF's projects in the region, including their PHE activities. And we have a couple other folks from WWF here who work on these projects as well. So we have a lot of people to call on. And then we'll hear from Rishi Bastakoti, who will tell us about how his organization, RIMS Nepal, is addressing health, environment, and population in the Mid-Hills region of Nepal. And one other thing to point out just quickly before we start is we have put together a paper on called Force for the Future, Family Planning in Nepal's Terai region, which looks at some of these issues in Nepal. It is not quite finished. It will be available online either tomorrow or Monday, and then available in fancier hard copies shortly thereafter. We do have some copies of it outside, although we warrant it still in draft form. Anyway, I'd like to stop there. I've talked already too much. One thing before we get started, when we get to the Q&A, please wait for a microphone to come around to you. We are webcasting, as you can see in the back, and so people are watching live now, and then the video will be up within about a week or so, so you can send the link to people. Related documents and these PowerPoints will be available, and other resources. So I'll stop there and turn the floor over to Jon. Thanks.
Thanks very much, Gib, and thanks to the Woodrow Wilson Center for having us, and thank you all for coming out on this blustery day. As Gib said, my name is Jon Miceler. I'm the Managing Director for the World Wildlife Fund's Eastern Himalaya Program. I have a pretty broad mandate of areas that I cover: Nepal, northern India, specifically northeastern India, northern Burma, where we're actually not working yet because of political reasons, among others, and the Tibetan Plateau and Bhutan, if I didn't mention that already. So it's a fairly vast area interconnected with a lot of other areas in Asia. And I would say that Nepal is probably, for many different reasons, the core of that eastern Himalayan landscape, not geographically so much, but because of the amazing successes that we've been able to have there over our roughly 40-some year history of working in Nepal, and specifically in the Terai region. And so the PHE topics that I'm going to speak about today are from a very specific area in southern Nepal in a region called the Terai, and it's a project that's known as the Healthy Community, Healthy Ecosystem project. And I've added several slides in here at the last minute that are will help explain, give a bit more background, because I think for some of you out there, you may not have maybe been to the area or know firsthand some of what we're talking about. So without further ado, I'll just jump right into it. I want to give you a little bit of background about WWF's, the evolution of our conservation initiatives in Nepal, starting with the era and going to the approach and the focus. When we began work in Nepal in the 60s and really through the 80s, we were kind of what a lot of people associate with WWF, a straight-up species conservation organization. We weren't so much involved in community initiatives. We were really trying to protect the great iconic species of Nepal: snow leopard, tiger, elephant, rhino, red panda, that sort of thing. And we were focused on the establishment of management and management of protected areas in situ for conservation purposes. As population changes began to occur, specifically in the Terai region, we realized that to get to our goal of species conservation, we really need to work much more with humans. And that was the advent of the Integrated Conservation and Development Project, which we were by no means the originator of, but very much took that up, looking more at how we can work through communities to get to our goal of conservation. And then really in the late 90s through the present day, we changed our paradigm a bit more to focus on landscape level conservation, looking at entire huge watershed ecoregions to try and bring about the conservation of whole ecological processes. Because by protecting a tiger, which was what we call an umbrella species, you're actually protecting a whole host of species below that and a whole host of ecosystems that are connected with the tiger. So you can begin with this umbrella species and you can spread out. You can sort of cover a lot of ground by focusing on them. And this focus was really on ecological and ecosystem integrity and sustainable livelihood. And that's where we are today. As managing director for this program, I don't personally have a huge amount of experience in PHE, but I'm here today because I feel that it really is the future. The landscapes that we work in today, no matter where you're doing conservation, whether it's Congo or the most remote areas of northwest Nepal and places like the Dolpo, or in Tibet's Changtang region, which is an average altitude of 15,000 feet, there's people everywhere now. And if you want to bring about conservation of these big, iconic species that need lots of area to roam, you have to work with the people that are living there. They have to buy into your program, or you're going to fail radically. And we realized that some time ago, and increasingly we're all about PHE type projects. So the focus of this talk is on the Terai Landscape, and it really is, in many ways, our flagship project in Nepal, and one of the flagship projects really in all of Asia. And it's outlined here in this slide. The bluish areas, I think that's blue. Purple. I'm really colorblind, you guys. It's embarrassing. But the purple areas are the national parks and the protected areas. And what we were realizing earlier on is that these were becoming islands of protected areas. And outside, they were increasingly surrounded by these oceans of people. And we realized that if we really want to preserve something like the tiger, we have to enable this creature to roam, to keep its genetics diverse. We have to enable it one day to be able to walk from Chitwan. I wish I had I do have a pointer. Chitwan area, which is here, all the way up to Corbett and areas in northern India. And so we began looking at ways of linking that and creating what's essentially a green corridor, and that's represented here. We're by no means fully there yet. This is an ongoing project that will actually probably go on for a good time to come, because we're dealing with such immense human challenges, mainly in the form of increasing populations in these areas. But the idea, again, is to link up this entire area, which starts essentially in Rajaji National Park in northern India and all the way across Nepal to Chitwan. And one day, of course, we have this vision for a region that will stretch from this area, Chitwan, where are we here? All the way across Bhutan, northeast India to Burma, ending in Yunnan province, so that you could have this massive green crescent stretching the length of the greater Himalayan chain and its satellite regions. Some of the significance of the region and why we're so involved in it. Some of these numbers in the biodiversity area are a bit dated. We're actually finishing up our latest tiger census, and those numbers will be out this summer. But they're roughly in there. 400 some rhinos, 300 plus tigers, elephants, 3 Ramsar sites. Does everyone know what a Ramsar site is? No. It's a high altitude wetlands type protected area. Not necessarily high altitude, but a wetlands area. And please, if you don't know some of the terminology, just shout out, and I'd be happy to answer that. A couple of World Heritage Sites, Chitwan and Suklafanta. The economy is probably, from economy and livelihoods from the PHE point of view, some of the most important. It's the rice bowl of Nepal. And it's meaning lots of the food is actually grown there that supports the country. It's also a huge revenue base for the country in the form of timber, ecotourism. That number dropped a bit during the Maoist insurgency, of course. And then it's a massive trade backbone because it borders India. There's actually no real border there. You can just sort of walk across, and there's not even a fence or anything. In a couple of places there's a stone that marks the border, but that's it. And then livelihood. This is where most of Nepal's population lives, and it's increasingly where a lot of Nepal's population is migrating to. Living in a vertical environment is really difficult, and it's much easier to make a living in a flat environment. And this is a simplistic statement, but it's really, really true. A lot of Nepal is very vertical. And a lot of people who grew up generation after generation in the mid-hills and higher saw ways of making an easier living by living in the Terai. And so there's been a lot of migration from the hills down into this region. And because of that, that has really been the catalyst that has caused a lot of degradation of the environment. A lot of these people bring cattle with them. Very, very poor. Many own less than a hectare. And most of them are forest dependent. I put this slide in kind of thinking that this crowd would be pretty young, and I think that there's probably no one here over the age of 90, I would say. And if there isn't anyone, that means none of you, including myself, have had the luxury or ever will have the luxury of seeing what an intact Terai was like sort of when the British were still there. And even post-British, well, not really. It was already pretty impacted after the British pulled out of India in 47. But these next couple slides give a bit of an idea of what it was like. I snapped this shot out of a relatively low-flying plane flying over the Assam-Bhutan border. And Bhutan, obviously, is this beautiful forested area. Bhutan has enshrined in its constitution that it will never let more than 62% of its land cover has to remain under forest in perpetuity. The border, obviously, with the Assam Dwars area is right in here. And what we have here is an incredibly fragmented landscape, tiny little islands of forest amidst this kind of sea of humanity. And the pressures, of course, on Bhutan are immense, but they've managed fairly well to keep this tidal wave of people back. And it's sort of indicative of what a lot of the landscape actually looked at one point. This next slide will show it even more. This is kind of what it would have looked like when the first Mount Everest surveyors were trying to make their way up towards Everest during the Victorian era. Relatively intact with bits of clearing in places like that, but really a really intact ecosystem. This photo was just taken 2 years ago, and it's the last remnant big area of intact sort of Terai ecosystem. And this is taken in northeast India on the border of the state of Assam and Arunachal Pradesh. And the reason it's so protected is because it's restricted. China claims this whole area, and India controls it. In 1962, they fought a war over it, and even though the Chinese won, basically, they pulled back over the Himalaya before the snows came and never rolled back in. But it's still a very relatively uneasy piece, and because of that, you have this this incredible forest that is frozen in a state of conservation, much like that amazing strip of land separating North and South Korea, where you have all that wildlife, because it's sort of a no-go zone. There are a lot of tribal groups in here. But this is what it used to look like in Nepal at that time. Today, what we're dealing with is a bit more like this. The photo on the left of these young ladies is indicative of what goes on every day, all day, across the Terai. This endless pursuit of firewood, yeah, of firewood for cooking. The photo on the right is what we want to get back to, and this is actually a successful regeneration of forests in I'm pretty sure it's the Suklafanta area, which is a park in extreme northwestern Nepal, southwestern Nepal. So that's where we're trying to get, and the population pressures, cattle, et cetera, are keeping us from that, but we're getting there increasingly through PHE initiatives. Some of the root causes and threats of environmental degradation and biodiversity loss, there's many, many of these. And any one of these I could speak on for this entire talk, so I'm just going to have to rush through it. Forest conversion, overgrazing, forest fires, extraction of timber, human-wildlife conflict, degradation of the Churiya watershed. Churiya is a Nepali word, meaning middle hills. The Hindi word is...
No, it's the lower part from middle hill.
Is it synonymous with Siwalik?
Yeah, Sivalik, yeah.
Same. Okay. So it's the middle hills, as he said. It's sort of what separates the flatlands of the Terai.
It's not the middle hill. It's
lower than the
lower
middle.
than the middle hill. Yeah.
So it's that strip between the middle hills and the lower middle hills and the Terai. Anyway, it keeps you out of the Himalaya. How we're dealing with these things, these issues, are forest management, restoration, alternative energy, and conservation-based livelihoods. Some of the other threats that we're constantly facing are the biological threats, and this is obviously where we spend, as a conservation organization, spend a lot of our time thinking about invasive species, use of agrochemicals, loss and decline of wildlife populations, imbalance of predator-prey populations, and flooding. And some of the ways that we deal with this are habitat management, species management, anti-poaching, and research monitoring. And I'm really not going to have a whole lot of time to discuss much of these, but feel free to ask questions at any point. Some that are more pertinent to PHE initiatives are the cross-cutting issues like population growth, low agriculture, inadequate access to resource management, cross-border issues. And the ways that we deal with this are policy work, transboundary initiative, transboundary being between India and Nepal, communication, education, and partnerships, public and private partnerships and such, working with communities. The focus of this talk is on our successful communities initiatives, and the idea here is that if we're going to protect these unique habitats and species that they support, we're going to have to do that through appropriate mechanisms, through working with the communities that are there. And this approach, initiated in the Eastern Himalayas, was expanded with the help of Johnson & Johnson support over the last 4 years, and it's called our Successful Communities Model. And it's derived from WWF's 4+ decades or so of global experience in sustainable development, helping people manage local resources. And it was developed following an assessment of needs carried out in 5 sites across Nepal. And we basically, my colleague has come up with this brilliant line, the Four Noble Truths. Anyone know where this is taken from, that idea of the Four Noble Truths is taken from? All right, great. So many conservation groups that are similar to WWF, when they're thinking about a community-based initiative, will often think about the lower 3, economic empowerment, natural resource management, and local governance. And they have their hands full with that. WWF is really, really focused on these 4, specifically community health and education. And that, in some ways, differentiates us from some of the other organizations that are out there in the field working with us and such. Just a quick plug for our people that have supported us in this. None of what we've done there, very little anyway, could have been done without help from USAID and Johnson & Johnson. So we are grateful to them for enabling all this to happen, both past, present, and future. The place in the Terai Arc landscape that we're going to focus is where this little yellow dot is coming up, and it's the Kata corridor. And Kata is a little region there, sort of in the buffer zone area between Bardia and Katarnagat Wildlife Sanctuary, which is actually over the border in India. And it's an area that we have spent a lot of time restoring linkage, actual forest cover linkage between the two areas, again, so that we can hopefully facilitate the movement of big species between these two protected areas, tigers, rhinos, elephant, etc. So just some baseline information to give you a little idea of what we were up against when we came in. Obviously, very, very resource poor. Average family, less than a half hectare of land. Does everyone have an idea what a hectare is? I didn't until not too long ago, until I actually got out and walked one. It's 10,000 square meters, and that probably doesn't mean much either, but it's not a whole lot of land. And less than a half hectare of land is actually what most of these people are dealing with, and it's very hard to eke a living out for a relatively large family size on one of these plots of land. The population is about 18,300 people, with an average per capita income of about $48, so it's really fairly poor. 3 hours walk to the nearest clinic. Actually, during the Maoist insurgency, which really got up and going in the mid-'90s to late '90s, and then the early part of this current decade that we're in, that clinic that I'm referring to collapsed, and so there was essentially no clinic there, which is extremely traumatic. I mean, imagine if we had no hospitals nearby or anything like that, and you had little kids. It's just an absolute nightmare for families. Dysentery, eye infections, pneumonia, all sorts of these very, very common diseases are part of daily life in this area, were anyway. Risk of HIV/AIDS, there's not a lot to do. There's not a lot of ways to make money in that area. So a lot of men actually leave home and work 9 months or more of the year in India. They're not with their families. They visit brothels, some of these people, and then they bring these diseases back home, and it's just disaster. In-home cooking, this is an obvious one again. When you're cooking over an open fire with little kids in the room, you're breathing that smoke multiple times a day, and it causes eye infections and chronic respiratory illness. So those are some of the issues that were dealing with when we came in, and actually in some cases are still dealing with. The threats and opportunities are sort of pictured here, rather than listing a whole endless number of sentences. I just wanted to put these photographs up. And the one in the upper left-hand corner here, again, is what goes on all day during daylight hours, mainly by women. They're the ones out collecting this. And this is just collecting timber for use in the house and largely for cooking. This represents encroachment. You once had incredibly intact forests, but as more and more people move down from the hills or come up from India to find more land, they move into these buffer zones areas and slowly encroach over time. And it's very hard for a government in Nepal, especially a new government with a shaky mandate still, to resist that, especially with this new Maoist government that is supposed to be of the people in a big, big way. To say you can't use the land or something like that for a protected area really kind of can come across as elitist, and so they avoid statements like that sometimes. But what ends up happening is you get situations like this where it's an entirely human landscape. Cattle's a massive problem. Many of these people keep cattle, and these cattle are almost useless except for dowry purposes. They don't give milk, and so they're kept and they're let loose, and they eat until the ground is manicured to like golf course like perfection. It's astounding, and it just goes on for mile after mile. They don't allow forests to regenerate in any way, and without a certain amount of understory, you can't have deer, and deer, of course, the base prey for tigers, etc. All of these problems were greatly exacerbated by the Maoist insurgency, which is represented by this photo here. The Maoist insurgency was perhaps most intense in some of the Terai areas, and in this Kata area suffered quite a bit. During that period of time, there was complete collapse of government and social systems, and basically there was people had to rely on themselves. There was, however, one group that was still functioning, and that's what we abbreviate CFUGs, or Community Forest User Groups. And WWF and some other organizations figured, well, this is sort of an obvious avenue to work through to reach the people. These are organizations that arose out of the communities. They're members of the community that come together to protect forests, to sort of take care of themselves. And so it was an obvious way to reach the communities is by working through them, because they weren't targeted by the Maoists and things like that. In order to identify these threats, WWF designed a PHE project program with 5 major outcomes, and some of these outcomes I'm going to quickly run through. The first is improved basic health care facilities and services. And what existed in this area of Kata before was just this building here. We built the top floor here, and we turned this into a permanent community managed health clinic with basic tools that you need to offer a community, really baseline level of medical services. And then we employed a full-time, what we call auxiliary nurse midwife. It's a really interesting term. I don't know the origin of it, Judy. I don't know either. Anyway, I meant to ask you about that. A direct result of of doing these two things are these numbers that I list here: 729 some patients receiving health care, nearly 3,000 patients receiving general checkups, 28 community members trained in first aid, and this one is particularly important because when you invest in training, obviously, a group of people and the skills, they then take that out to the villages and places where you as an organization, due to your own human resource and funding limitations, can never reach. And so you greatly expand your reach, obviously, by training up a cadre of people that can then head out into the field and reach people that you wouldn't normally be able to reach. Reproductive health and family planning was, of course, a major issue. I mean, it's actually, in some ways, the root cause of a lot of our problems in the Terai is population, people being there. Does anyone have an idea of why so many people were able to come into the Terai? What enabled this sudden access to the area? Less than 100 years? Perfect. Yeah, exactly. It was a malaria eradication, getting rid of the mosquitoes. Not to say they're not still there. They are still there. But that was the reason that so many people have been able to come and really thrive in that area. Now we're dealing with intense population pressures and all kinds of nationalistic issues that are coming up because, as people differentiate themselves over land issues, they often point to their ethnic background, claiming to be indigenous in certain places. And that's actually led to this current fighting that's going on right now as I'm speaking in Nepal between the Tharo people and the Madhesi, which has actually blocked us from access to our main project site in the Terai, Chitwan. Anyway, this reproductive health and family planning aspect of the project has been incredibly successful. And what we did was we trained 32 female community health volunteers to become advisors in family planning, and then 15 youth peer educator groups with roughly 20-some people in each of those. And then these folks, again, went out and were able to hold conversations in communities that we could never do that. Even other Nepali people from Kathmandu could not enter homes in the Terai of completely different ethnic groups and talk about these incredibly private issues of reproduction and that kind of thing. The result was couples using family planning increased from 4,000 some in 2006 to 4,400 in 2008, and the contraceptive prevalence rate jumped from 43% in that period of time to 73%, which is really amazing, actually, in an incredibly conservative society such as the tribal groups in the Terai are. Improved sanitation and drinking water. All across northern India and down into Bangladesh and places like that, you have a lot of trouble with naturally occurring arsenic in the water. and it's a real problem. And you just you don't even know you're suffering from it until later, and you get all these kinds of terrible outbreaks on the hand. I think probably many of you know what I'm talking about, what arsenic poisoning can do over time. And what we did to try and mitigate that was to provide 172 of what we call Kanchan arsenic filters. What is the meaning of Kanchan? Any idea what that word, the origin of that word is?
Kanchan? Like clean.
Okay. Were distributed in areas with high level. These filters were distributed in areas with really high level of arsenic. 44 safe drinking water hand pumps, and these hand pumps actually drill far below where a lot of the arsenic lies and reaches the aquifers that are usually free of arsenic. And then the creation of nearly 800 inexpensive latrines were constructed to improve sanitation in the area. Just catch up with myself here. Improved conservation awareness is obviously a strong point for us. Again, we provided a lot of extension materials and distributed these through people that we trained. Some 375 people were provided with this sort of literature and graphic representation of what we're trying to talk about. And through that, we were in turn able to reach probably over 4,000 people through campaigns, cultural programs on issues of population health and environment. Conservation management has again been a very successful one. 136 biogas plants with toilets attached. Everyone know what a biogas plant is? Okay. Just say so if I'm saying anything, because it obviously I can try and elucidate that. This is.
Just a question.
Please.
You keep referring to certain numbers. Numbers relating to certain area of Nepal.
I'm talking specifically right now about the Kata corridor area. Yeah, between that and Kartarnagat in India.
How many square kilometers?
I got that statistic. Hang on. The Kata corridor area is about 82.6 square kilometers with 18,300 people, roughly 2,600 households. Average population density, 222 people. Biogas has just been an amazing thing, and it's going to happen more and more across developing areas of the world. We're going to initiate China's been fantastic with this, but we're going to ramp up a lot of our efforts in areas of eastern Tibet, because there's ones that you can do with high altitude. But in the Terai, it's been incredibly successful, and we're going to really, really increase the number of these that we're putting in, because I'm going to move quick here now. It greatly reduces sickness in the household due to respiratory illnesses that are in turn caused by the burning of wood over an open stove. Huge amounts of forests. We estimate 712 metric tons of fuel wood. And then it saves women a massive amount of time. We put 3 hours a day, but it's actually far more than that, out every day collecting wood. Stall feeding and introduction of improved breeds of cattle, mainly cattle that actually produce milk for kids and people to drink, has also been a successful aspect of this program. Impacts: population and health, affordable and reliable health services, significant increase in conservation use, improved water, sanitation, equaling the reduction of diseases, 20% of the population with access to arsenic-free water. We obviously have a long way to go on that. Impacts, environmental impacts, increased forest cover, a reduction of human-wildlife conflict, conservation support of communities, because we really create a strong awareness of the linkage between conservation and their own benefit. Some of the lessons learned. This is an obvious one, but I should state integrated PHE programs really have far-reaching effects on people and environment. Building these projects on existing community institutions is a really cost-effective and way of going about things and produces quick impacts. Multi-level stakeholder coordination is critical. An endowment is a really, really important one. We have a roughly $15,000 endowment established, but this needs to be embellished over the years so that this is able to remain sustainable. So that's of course, funding is always an ongoing challenge no matter what you're dealing with. And getting government buy-in from this and support is critical too, and that's something that we're working with the new government, because it increases the trust amongst communities if government is involved. And then, of course, a well-defined monitoring plan in order to figure out if you're being successful or not is very, very important. A lot of words here. Just basically, very quickly, scaling up. Support from USAID and Johnson & Johnson has helped in establishing this a foundation for multi-year population health and environment. And that's just kind of what I was talking about, this initial fund of $15,000. But this will enable us to scale up from where we started here in Kata as well as in other areas. WWF has recently partnered with USAID's Office of Population Reproductive Health and Johnson & Johnson on a $3 million 3-year global development alliance, which is supporting scaling up all over the world in DRC and Kenya and Nepal. And then finally, Nepal. In Nepal, our project is taking results from the successes that we've had in the Kata corridor, and lessons learned from other PHE projects in other countries, and scaling them up in other areas of the Terai, like the Lamahi bottleneck and the Basanta corridor, which are two areas that are very similar to the Kata corridor. That's about it. Do we want to take questions now, or just? Okay, good enough. Thank you.
Okay, thank you very much, John. Okay, now we'll hear from Rishi.
Good afternoon, ladies and gentlemen. It's my great pleasure to be here with you. On this occasion, I would like to express my sincere thanks to Woodrow Wilson International Center for inviting me to give the presentation. The topic of my presentation is Population, Health and Environment in Nepal, the Success, Challenge and Lessons from RIMS project. You have already heard about what is the PHE project and how it's working, because these are the two projects in two locations, and most of the things we are going to present are the similar. And this is the outline of my presentation. First, I will present the Nepalese context on population, health and environment. Then I will introduce what is RIMS Nepal and how we are integrating population and health, and what are the major interventions and best practices and what we learned from this project. And finally, I will share some of the issues and future directions. As you know, Nepal is a small landlocked country in the South Asia, between two giant and populated countries, India and China. The population of Nepal, according to the 2001 census, is over 23 million, and it has become doubled within last 30 years. The main cause of this population growth is the early marriage, early childbearing, and the narrow birth spacing. It's interesting to share here that more than 1/4 of the women give birth of the child at the before the age of 18, and more than 0.5% of the women have had the birth by the age 20, half of the women. And according to the National Demography and Health Survey 2006, the average fertility rate in Nepal is 3.1, but it is much higher among the ethnic communities living in the remote areas with low education. And we are working in this type of area. And 25% of the women have unmet need for the family planning. And according to the national data, contraceptive prevalence rate is 44%. And when we go to the environmental aspects, the solid biofuel is the main source of the fuel energy in Nepal. More than 83% people use that type of energy, and firewood is the main source of energy. The traditional Nepali stoves are very much polluting. It's the main cause of the indoor pollution, which is 15 times more polluted than the WHO standard. And the women and children obviously invest more time in the kitchen, therefore they are more suffered from the respiratory disease. The one study from WHO shows that 7,500 deaths per year is due to indoor pollution. If we compare this with the outdoor pollution, it's 10 times more than the outdoor pollution. And the death toll due to insurgency and conflict is always the popular political agenda in the countries like Nepal, but these things are ignored, or it's not, the steps are not taken to on these aspects. And the total forest coverage in Nepal is about 29%, and deforestation rate seems 1.7%. This is due to fulfill the need of the firewood and expansion of the agriculture and for the settlement. We jointly with Care International, WWF and RIMS Nepal have carried out one biodiversity threat assessment recently, and the result shows that most of the causes of the deforestation are either the population growth or the poverty related type of things. He has mentioned these things already. And we have taken so many initiatives, but these initiatives are more sectoral. Therefore, we have seen the opportunity to integrate population, health and environment in the community forestry agenda. The community forestry is the community-based forest resource management regime. It's Nepal is pioneer and very popular for the community forestry management. And the government has the policy to hand over all the accessible forest to the accessible communities for its protection, management and utilization. The community forest user groups are one of the strongest grassroots organizations with resource. These organizations have very good contribution for restoration of the forest as well as the community development. I have put some of the publications in the desk. You can see one photograph. Sorry, I could not locate the season to take these two photographs. How the community forest user groups are contributing to restore the forest, you can see in the publication, but I could not locate the season, therefore it's seasonal difference. But anyway, you can see how it's changing. And there are more than 14,000 forest user groups involving more than 35% of the Nepalese people to manage the community forest. It's about 1.2 million hectares of the forest. The community forestry program is one of the successful program in Nepal, but it's especially very much successful in the mid-hill region. In the Terai region, basically the buffer zone type of forest management is very much successful, and the mid-hill is very popular for the community forestry management. Therefore, there is the scope for integrating population and health agenda in the community forestry agenda. You can see the scenario. People in the mid-hills are living in the remoteness, and if they have to climb down 3 to 4 hours to get some government facilities, like if they have to consult the health officials like that, they have to climb down, and even it's difficult to meet the health officials. And this is the family of one of the Chepang family. They got married before 16 or 17 years age, and they have already 8 children. It's the scenario in the Chepang or Tamang communities in Nepal. And since the poverty and poor sanitation and how the people are using the firewood, it's inefficient cooking stove. Yeah. And let me introduce my organization. The name of my organization is Resource Identification and Management Society Nepal. It is a local NGO. It's not for the profit making. Actually, we developed this NGO from the USAID supported natural resource management project in 2001 to develop our local leadership and for the sustainability of the initiatives. We are working with more than 500 forest user groups in mid-hill regions of Nepal. Special focus of our organization is participatory resource management, community development, livelihoods and policy advocacy. You can see how we came to integrate population, health and environment into natural resource governance agenda. Actually, we started our work through the community forestry, especially in the governance in the natural resource management with the support of USAID. While working in the governance, we found that the social inclusion and equity is very important, and we address pro-poor community forestry program. And then we found livelihood and biodiversity are the important agendas to be addressed if we really want to have the participatory forest management. And when we talk about the livelihood support, the short-term income generating supports like 2 goats or some small grocery supports or small type of supports, it does not bring a very big change in long run. If we teach the people to have manageable family size, then it will be great contribution for the livelihood as well as biodiversity. Therefore, we integrated population, health and environment in the community forestry agenda in 2006, and we are doing policy advocacy type of things to link our micro level learnings in the macro level and for the policy influence. And we found that the PHE has a great contribution in both sides, in the livelihood side as well as in the biodiversity conservation side. And this is the approach, this is the framework how we are working. We are working to increase the access and use of the reliable methods of the family planning, because there is the big gap between the unmet need and the supply. Therefore, we are working with the married couples to increase the access of family planning, to reduce fertility and to increase the birth spacing, as well as we are working with the youths to delay the marriage and childbearing. Therefore, they will have the opportunity to participate in community forestry, other community development work as well as other productive works. And another intervention is we are trying to increase the access to smokeless fuel efficient stoves because of 2 regions, especially 2 regions. We want to contribute in the reduction of the indoor pollution, as well as we want to decrease the demand on the fuel wood side. Ultimately, we want to contribute the post-conflict building and democracy in the new Nepal. As you know, the PHE is the pilot project in Nepal. One was done in the Terai region. Jon has already presented about the success of the Terai region, and we are working in the mid-hill region. The green part is the mid-hill, the yellow part is the Terai region. These 2 parts are the highly populated regions. And we are working with, as it's a pilot project, we are working with 82 forest user groups in 9 VDCs. 3 VDC is the lower political unit of Nepal, Village Development Committee. In 3 village development committees, the VDCs are dominated by the Chepang, one of the marginalized ethnic group, and 3 are dominated by another ethnic group, Tamang, and other 3 are the mixed group. And we have the multiple partnership, and we got the technical support from ADRA International, and financial support was from USAID through CDM. The duration of the project was 2 years with 6 months extension. The main goal of the project was to improve the quality of life in the forest corridor and ecosystem while ensuring the sustainable management of the Nepal's natural resources. And the objective, there are 3 objectives. One objective is to improve the health outcomes of the people living adjacent to the forest ecosystem. The second objective is to enhance the capacity of the user group and other community agents to promote human and ecosystem health using community-based and integrated population health environment approaches. And the final objective is to increase support in forest user groups for PHE perspective that are implemented in sustainable ways. To achieve these objectives, we have several interventions. We have grouped these interventions into 3 broad categories. The first intervention is awareness raising and education. Another is local human resource development. And finally, the third one is institutional support for this. We have carried out several activities for these interventions. The most important one is the stakeholders meeting and awareness for them on how and why we have to integrate population and health agenda in forestry management agenda. And street drama is one of the very popular means of public awareness, because it's a very live to aware the community people, rural people who don't have a very good education, but they can learn from these things. And we use different extension materials. Some of them we developed ourselves, and some of them we shared from other organizations, including USAID funded other projects, WWF and other organizations. And literacy classes for women and girls are one of the very good entry point for the PhD. And the exposure visit, and another important program for the awareness raising is the radio programs and radio jingles on population health, reproductive health, and clean energy, like that things. And another is the local human resource development. Rather than creating the parallel institutions, we try to capacitate the grassroots level government institutions. We provided several trainings to the female community health volunteers to work as a community-based distributors. They are working in the grassroots level for the health institution, as well as we also give training to some of the male community-based distributors. Actually, they are the promoter of the family planning contraceptives in the community level. Generally the male people are shy to ask the family planning contraceptives to the women's. Therefore, we tried to develop some male community-based distributors, as well as we developed the peer educators, adult peer educators to deal with the married couples, and the youth peer educators to deal with the younger ones, both male and female. You can see these are the very active outreach, PhD outreach workers in our working sites. And we promoted the we trained for the improved cook stove promoters, because it's a very simple local technology, and if we give the training, they can work to promote the improved cook stove in Nepal. And another is the institutional support. We work together with the district health office and district forest office, and we organized coordination meeting with multiple stakeholders to bring together and to bring the synergy, and we facilitate for the resource leverage for population health and environment at local level. And we work together with the female community health volunteers to support them in monitoring activities and to outreach their services. And we jointly supported the outreach clinic. It's the clinic in the village. It's once a month. It's under the government institution, and we jointly supported. The government supported some basic medicines and health equipments, and we supported some furnitures to improve the outreach clinic's health facility. And we organized the service delivery strengthening type of workshop, because our interim constitution has guaranteed the right of people to live in the clean environment and to have the access to basic and free health service, but the people don't know about this. Therefore, we organize the service delivery strengthening workshop, and it has the both a good result from the supply side as well as from the demand side. And finally, we did the revision of community forestry operational plan, integrating population health and environment agenda, because in every community forest user groups, they have their own charter and they have their own community forestry operational plan. Generally, it's for 5 years. Before the PhD intervention, it was mostly focused on the forest management type of issues. Now we integrated population and health and environmental issues linking with the forest management. You can see some photographs for the service delivery strengthening workshop. And now let's talk what are the major outcomes of the project. One of the incredible outcome of this project is increased contraceptive prevalence rate. The base value was 44%, and now it goes up to 63%. It's because of the increased effectiveness of the project's capacity building inputs, successful delivery of the PhD intervention by the trained outreach worker, and now the people in the forest user group understand the importance and the necessity to limit the family size to assure sustainability of the forest resource as well as for their livelihood. And another achievements are the promotion of clean energy and reduction of the disease associated with the indoor pollution. You can see the graph how the acceptance of the clean energy is being increased. Mostly we have promoted the improved cook stove and side by side the biogas also, because biogas is quite expensive for the poor people, and in the mid-hill region one can install the improved cook stove. I think in $8 to $10, it's not very big deal, and the promoters are the local one, and therefore they can barter. The improved cook stove promoters can work for them, and they can pay the labor for them also. Therefore, it's a very easy method in Nepal, especially in the mid hills. And because of these clean energy intervention, we have recorded that the acute respiratory infection has been going down. You can see the inverse relation between the clean energy and the ARI case referral. And there are different effects of the, different effects of the promotion of clean energy. One is the saving in the firewood. Because of this clean energy intervention, because of the installation and use of the improved cook stove and biogas, additional 1,178 metric ton of firewood has been saved per year because of this intervention, and it has great result to save the time of the women's and improve the health quality, health and hygiene in the kitchen. And another achievement is development of PHE outreach worker. We have already developed local volunteers. There are 375 local volunteers. Some are the local resource person, because there are local resource person already working in community forestry user groups, and we reoriented them from the PHE perspective. Now they can integrate these things in the forest user groups, and we have developed the peer educators, and we have developed improved cook stove promoters, ICS promoters, and community-based distributors. They are the local one. They are working there, and it's a very good achievement, and it's a very good helping hand for the government institution also. And we were able to leverage the resource of about $47,000 from forest user groups, village development committee, government line agencies, and other donors and partners for community sanitation, outreach clinic improvement, improved cook stove, biogas, and the support for the reproductive health and childbearing type of things for the poor people. And another achievement for the sustainability is integration of community for population health and environment activities in community forestry operational plans. We are able to integrate the improved cook stove installation, outreach clinic management, toilet construction, pregnancy and delivery care of the poor, forest user group members, and awareness creation on HIV/AIDS, family planning and clean energy in 25 forest user groups. And we have the literacy classes, and we have developed some materials based on the learnings of these in our other ongoing programs, and this is also very good achievement. And I'm going to share some of the best practices of this project. The population and health integration into participatory forest management agenda itself is a best practice. I would like to say it's the very best, it's the best practice. And the development of local human resources as a PHE outreach workers has increased the importance of the integration of the population, health and environment in forestry and health institution. This is also the best practice. And clean energy promotion has become the champion in PHE working area. And the integration of the population, health and environment agenda into community forestry operational plans, and the resource leverage from different institutions for PHE perspective. These are some of the best practices. These are some very good examples of PHE intervention. She is Mithu Magar. She is 28 years and she has already 5 children. And she has been selected as the adult peer educator, and she got the training, and she got to know that there are many options for family planning contraceptives, and she wanted to be a role model, and she chose one of the family planning contraceptives, and she is very active in counseling the people in the rural area, especially in the remote areas, in the Chepang communities and Magar communities, and she was able to counsel one deaf and dumb lady. She has already 4 children, and she was able to counsel her, and the dumb and deaf lady denied to bear another child and asked her husband to go for the permanent sterilization. It's a very good achievement, because it's the counseling is difficult, and to counsel for the dumb and deaf is really difficult, and she did this nice job. And this is Mr. Mangal Das Thamang. He is the super promoter of improved cook stove. He is sharing his experience with Mr. Flynn Fuller. He is the director of USAID South and Central Asian region. And this guy has already installed more than 300 improved cook stoves in the communities. He has got very good income from his job, and he has very good name and fame in the community, and his contribution to save the energy and to make the hygiene, to reduce the indoor pollution is incredible. And this is one example how the collaboration improves the access to the health outreach worker, outreach in the communities. Before the PHE program, the outreach clinic was not really functioning. Hardly 5 to 10 people used to go there. But the PHE and government support stimulated the communities to strengthen outreach clinic, and the community 5 community forest user groups leverage resources and volunteer labors to renovate the community building as an outreach clinic, and the health post authority is also committed to manage the quality human resource to run the outreach clinic. You can see this case story in this publication also. And now there are more than 50 patients in the outreach clinic. And this is the best example how the integration of population, health and environment can bring the result in clean energy and clean village. Another USAID supported natural resource governance project is working in this forest user group. We integrated population and health agenda in this group, and now the forest user group committee member are the active outreach workers in the PHE. And the PHE became one of the important agenda in the forest user groups, and they have allocated significant amount of resource for the improved cook stove and latrine construction as a campaign in all the 136 households. It's a great achievement. And this is the media coverage, and the success of the PHE project has been covered in one of these daily newspaper. English daily newspaper is widely circulated in Nepal. And now I am discussing some of the key lessons learned from this project. Integrated approach is essential to achieve the better balance between human and natural resource for more equitable and sustainable development. And the governance, especially the natural resource governance program, is the important to prepare the ground, and the integration of family planning and health brings added value to conserve for the conservation, poverty reduction and the livelihood improvement. And the local volunteers are the key for the success of the PHE program. And another important learning is ICS promotion is poor friendly approach. Improved cook stove promotion, what I discussed, is the poor friendly approach to reduce indoor air pollution and to ensure the fundamental right to live in the clean environment, because our constitution has already guaranteed the right to live in the clean environment. Now is the time to translate the policy into action. And another big lesson is well planned and well executed PHE can contribute directly to the Millennium Development Goal, because it's one of the challenges to how to achieve the Millennium Development Goal. It has the direct contribution to achieve the Millennium Development Goal number 4, reduce child mortality, and 5, improve maternal health, and the 6th one, combat HIV and AIDS, and 7th, ensure environmental sustainability, and the 8th, develop a global partnership for the development. And it has the indirect contribution to other MDG goals like the poverty eradication, primary education and gender equity and the empowerment. And the issues and future direction. The PHE have very good initiatives. Now it's the issue is whether it will be sustainable or not. For the institutionalization of these initiatives, first the people have to internalize the things and institutionalize the thing. We are trying our best, but we are not sure whether this 2 years period is quite enough for the institutionalization or not. And as I already shared, this project has very exciting results, and now is the time for scaling up of the program after the successful piloting of the experience. And the recognition of this approach at the national level is important, because our constitution has already guaranteed the right to live in the clean environment, and we have already prepared the indoor air quality standard, and it's on the process of drafting the guidelines for the indoor air quality, and we have the scope to work in the future with the through community forest user groups, because it's one of the greatest grassroots level institution, very strong, and we can intervene the PHE approach to get the result throughout the country, and therefore we need some policy advocacy type of things and some additional support for this for the scaling up. And for this, I have to acknowledge USAID for the funding support, and the USAID supported Shogun program, Camp Dresser, and Mackey International, Woodrow Wilson Center, ADRA International, Government of Nepal. And I have to acknowledge the support from Leona Giagne, Heather Giagnes, Linda Cantrou, and the people of the project area. It's all from my side. And if you have any questions, and if you have any interest to work together in Nepal, we will be pleased to work together with you. Thank you very much.
Okay, Jon and Rishi, thank you so much. Those were great. Those were great presentations, and I look forward to the discussion period. Who would like to start us off? And remember to wait around for a microphone. I think there's 2 questions right here, Rachel. I'm sorry, right there. Yeah.
Thank you. My name is Mohan Dangi from Johns Hopkins. I have 2 questions or comments for both speakers. First question is, there is a great deal of work by Arun Agrawal of University of Michigan and J.C. Rivett of WRI here in Washington about decentralization, decentralization effort and governance at the local level in Nepal, especially in forestry, at least in literature. And they mention about only 10% of Nepal's forest belongs to community forestry. There is a great deal of friction between CF, UG, and government in handling the forestry. Here I learned 1.2 million people participate, 35% of forestry, and that the goal of the government is to completely hand over to the local. Could you please comment on that alongside the friction to hand over the sal or Soria robust to the hardwood tree to the community user groups? What effort has been done, and then how cooperative the current government is? That's the first question. And the second question is about, you mentioned quite a bit about energy, the cooking stove. There are numerous organizations such as Biogas Support Partnership Nepal, Center for Energy Studies at the Tribhuvan University, Center for Rural Technology. All these, they have been working together. Even today there was a news, the national government in Nepal is providing subsidy for the solar cooker and basically the solar system in urban areas of Nepal. And how about the prospect of working with those organizations at the community level? And I like your ideas. Could you please comment on those 2 questions? Thank you so much.
Regarding the handing over of the community forest, especially it's very successful in the mid-hill region, because the most of the forests were already degraded in 1970s. Therefore, government was compelled to get the support from the community. Therefore, it's very much successful in case of Terai, and I agree with you that the government is still skeptical to hand over the resourceful Terai forest to the community. And still the debate is going on. We are working with the Federation of Community Forest User Groups, and now it's relatively positive, and the trend will increase. I hope so. And regarding your second question, yes, there are other organizations also working in the improved cook stove and energy type of things. But what the experience is, we also worked in the ICS and biogas before this PhD project. But our focus was that to save the energy. It's not really motivating factor for the rural poor. If we link these things with the health outcomes and population and health type of things, and it really works. And the scope is that we can intervene this type of approach to with other organizations, even with the government, and it will make sense. I hope so. And there is the scope to work together with these organizations. I also went through the news, as you mentioned. It's a very positive thing. Thank you.
I think there was a question right next to him. Yes.
Hi, this is Jed Moline with USAID. I'd like to congratulate both of you on your outstanding outcomes in your project areas. And a comment and the same question to both of you. First comment is, I think you should put the people of your project areas the first in your list of people to thank in your next presentation. But both of you mentioned the importance of taking these interventions and scaling them up. If I may ask the impertinent question, how long did it take you to achieve your successes that you described? And if I may be so blunt as to say, what was sort of the cost or the funds you needed to do these, raised from either aid, Johnson & Johnson, or other sources?
Judy, can I ask you to comment on some of that?
Sure.
Can I just introduce Judy Oglethorpe really quick? Probably many of you know her, but she has actually led many of our projects related to PH&E, so she's actually far more in a better position to speak to this question than I am. So Judy, if you could just comment on that.
Yeah, okay. So in the Kata area in Nepal, WWF worked, the reports that... Oh, who am I? Sorry, yeah, okay. Sorry, so Judy Oglethorpe, I work in WWF, and I work along with my colleague Terry Lucas here on our Population Health Environment program. So based in the US here, my job is managing director of our People and Conservation program, but a lot of my time has been focused in the last 5 years on our population health work. And so we have projects in about 10 different countries around the world. So the Nepal project has been focused here. So in Nepal, we worked for 5 years. We got Johnson & Johnson funding starting in 2003. And I think for Nepal, I'm not terribly sure how the program allocated, because it was also allocating money to Bhutan and India, but I think it was sort of in the region of something like $30,000 or $40,000 a year over 5 years. And then in 2006, the USAID Nepal mission provided some additional funding, actually $80,000 over 2 years. So that gave another $40,000 a year. With the Johnson & Johnson money, we'd been working with the Red Cross, came into the clinic, did first aid work, did some family planning work, did the sanitation and the water and everything. But when the USAID money came in, it really let us take the project to another phase by really focusing on peer educators, really emphasizing family planning and the fuel efficiency, and then starting on HIV/AIDS. So I would say, $30,000-$40,000 a year to start with. Let us do the minimum, but it didn't let us take full advantage of what we were trying to do. And having the mission money coming in and really helping us to focus on certain issues really took the project to another scale, really sort of enforced it. Now under the GDA, we have we're scaling up, so we're still working the Kata site, but we're going to 2 other sites, and we're also trying to sort of do more work nationally as well. And if I remember rightly, under the GDA, I think we have maybe $240,000 a year for Nepal over the next 3 years. So that's with this Global Development Alliance between Johnson & Johnson and USAID. Okay, I hope
Rishi, did you want to add?
Yeah. Actually, I shared the outcomes of the project. It was the funding from USAID was $80,000 for 2 years. From this, what we can learn is it's really a cost-effective approach to work in the communities. Therefore, it's better than to work in the sectoral approach. We can bring a very good result in low cost. Yeah.
Let's go here to Hannah.
Thank you for these interesting presentations. I'm Hannah Fairbank, a biodiversity specialist with USAID. I guess it's a pretty general question. PHE is a fairly new intersectoral field, and I'm interested from your perspectives, what are some of the big unanswered questions or some of the big challenges that you see this field having to take on, over the next, 5 to 10 years?
I'll just talk about that first. There's how to scale up and keep the situation sustainable is one of the issues that we're dealing with, monitoring that over the long term, and eventually how to extract ourselves from the process. In the sense that obviously the goal of any NGO is to work itself out of a job somewhat, but it's going to take quite some time in an area like the Terai in particular that is under so many different challenges. I think getting the politics stable first is probably the number one thing that needs to happen, and we're not entirely there yet. Just to give you an example, as I mentioned before, we're in the middle of a bund right now that has blocked my entire office in Kathmandu from going down to our project sites. So that's an ongoing issue. A bund is a strike, meaning that it's when some group of people have some grievance, they will block all the roads so that no movement. And if you try and drive, they'll actually sometimes attack your car. So it's not the best way of doing things, but it's one of the biggest issues. If you look at areas that are a little bit more stable, such as in Bhutan in the Pobjika Valley, where some of our PH&E initiatives have gone on, it's much easier in some ways to monitor successes there, because you have a baseline level of stability and a baseline level of it's not purely a subsistence existence level there, so you can rapidly scale things up. But I would point mainly to politics. We have to get that stable first, get a constitution in place, one that actually has enshrined in it language that pertains to the environment, and one that is accessible to the people so that they know how to contact their government related to issues related to natural resources. So these are really big picture answers. I don't know if I'm hitting the specifics.
Well, it would be interesting to have an answer that focuses uniquely on the challenges of linking those three sectors. I just said, this is interesting, but it sounds like those are issues that would face any conservation intervention in these countries. But are there things that are specific to linking P, H, and E that are, big questions or big challenges that are out there?
Kara, you mentioned you want to comment on that as well. Kara is also my colleague at WWF, and she's been very involved in this too. So,
I come from the health side, and I'm working in conservation. Oh, and I'm working in this conservation organization for the first time. I can tell you from the donor's point of view, aid, for instance, has been working in a very narrow sectoral way for years now. We are embarked on an integrated project. So we are put in the position of having to defend and support with real data the merits of an integrated program. From the population side, we will be criticized because we're in small areas. We're not working with huge populations by definition. We're in remote areas. From the biodiversity side, it's why are you spending money on people when we're interested in biodiversity? How does helping a child avoid diarrhea affect biodiversity in this forest area, for instance? So the challenges are producing monitoring and evaluation without spending huge amounts of money, because you have ethical issues also of having controlled experiments, money issues of having controlled experiments and trying to generate the kind of data that will convince decision makers in Washington that these projects are viable and are sustainable.
Rishi, you had something to say?
From the implementer side, because I am implementing the project in the grassroots level, and from my perspective, from our perspective, what I want to add is, it's our challenge and opportunity to bring the empirical evidences to prove that these three components are really interlinked, and if we work in an integrated fashion, it will bring really benefits for the conservation as well as for the livelihood of the people. You can see in this publication that the better health outcome due to the PHE intervention. Actually, we did not have very big intervention in the health sector, but we work in the sanitation and clean energy type of things, and the scenario of the top 10 diseases on that locality has been changed. And we can bring that type of evidences for the policy advocacy for the government, as well as to the it will be also beneficial for the donors to pay more attention on these aspects. Thank you.
Just one last comment on that. Measuring that is something that is kind of crying out right now for some sort of assessment, and we unfortunately didn't miss, but we weren't given a grant that would have looked just at this particular issue in the Terai area. The grant didn't work out, but we very much want to address that in a way, because we're really speaking in abstracts at this point. To look at that, we need to speak. We need to look at an evaluation, a monitoring plan over time. Right now, we don't. We have that in place only in isolated areas, but to look at it across the Terai is something that really is yet to be done in a sustained way.
Okay, and I'd just like to add, as sort of an observer to a lot of this dialogue around PHE, is that I think that the sort of systematic approach, the systematic M&E, the data collection from the beginning of project is something that has been missing. I think it's coming along in some cases, but I think I'll echo your call for more. Mm-hmm. A question up here, and then a couple on this side of the room.
Heather Jeffen, private sector, and we often complain about the donors not working together, often work against each other. How did you manage to pull all the resources? Another factor is the infrastructure, technical infrastructure. Somebody mentioned radio. We do radio. I assume there is no electricity. And how could you pull the government to do basic infrastructure? Because that's really changed. And we also heard success about the project. We don't know how much the population has been reduced, like planning, family planning. I think Jon said a lot about that, but okay, what's the result? And I also like to say what Kara said, that integrated approach, the only way really to address all these issues successfully and sustainable.
Okay. Yes, I agree, because it's not so easy to bring all the donors to work together. It takes more efforts, but we have to do on that line, because we have invested so many resources separately, and if we are really sincere on the poverty and the development, these type of issues, we have to come together in the common agenda, because we have to work together like that. And we have initiated some things from very operational level, because in my presentation also we got some resources from German embassy. I proposed them. We are working in this line. Your small support will have a very big contribution. Sometimes I found the competition that to do a good thing is not the major thing, but who did this thing is the major thing. Therefore, we have to work in the integrated fashion. And regarding the infrastructure and other things, especially from the Nepal during the insurgency period. Most of the infrastructures were collapsed. Therefore, it's really difficult. If we cannot come together, it needs huge resources, and it's really difficult. And regarding the radio programs like that things, we are working together with the community radios. And it's a very good cross learning for the radio people. No, it's with dry cell. Dry cell. We can operate through dry cell, and we can use that also. We could not find that technology, therefore we promoted with the dry cell.
Yeah. Judy, could you talk about some of the synergies with USAID and Johnson & Johnson in particular?
I think our case is really interesting. We started off with two pretty separate projects. Johnson & Johnson came in to fund health and related environmental work, and the Office of Population and Reproductive Health, around about the same time, gave us funding for family planning and linked sort of environmental education activities. And they were run in WWF out of separate departments. I think, for a while, one of the sites was in common for both projects. So both projects funded Kenya. And we started to see, the advantages of actually having the family planning and the general health and environment money run together. We also saw that in some places where we only had family planning money, it was difficult to move forward because we didn't have general health. People needed to keep children alive before they were interested in using family planning and this sort of thing. So as we went along, we came to realize more and more the value of taking this sort of integrated approach and integrating our donors, and this sort of led to us meeting with both donors together, and eventually, after a period of probably about a year, actually developing a global development alliance, which we're absolutely delighted about, and for us is fantastic. And I think both the donors are pleased to be involved in it too. But it was something that we didn't know to begin with. It's something that we learned the hard way, that actually it's so much better to bring these resources together and work in a very integrated way rather than stovepiping things. So for us, that was a really important learning experience, I think. In terms of bringing government in, this was particularly difficult in the Kata project because it was during the Maoist insurgency. Government had kind of had to close down in much of this area. The local sub-health post was closed, and this was the one that was 5 kilometers away. And this is why the communities decided, this group of, it was actually 32 community forest user groups, decided to do this clinic as a community clinic because they had no other access. We did work to bring government in as and when it was possible. So, for example, a government inspector came in to inspect the clinic to make sure it was being done properly. And now that government is more back to normal, actually, the sub-health post is opened up again, and there is a much closer working relationship with government. But as you said, it was a real challenge during the insurgency. During times of conflict, it's very difficult. And often at that time, NGOs have to actually take action and do things we might not normally do. I mean, for example, setting up a community clinic rather than a government clinic.
In addition to that, we are trying to do some policy advocacy type of things through NGO federations in Nepal, as well as the international. We are giving this message to the AIN, the IAN, the international NGOs working in Nepal. We are trying to give this message to that that networks also.
I'd also just like to say many of your questions could probably be answered by this booklet that Judy and Kara have put together. It's a fantastic book, and it's free, I think. Totally free, and we have plenty of copies. We'd love you to come grab one. It outlines everything that we've kind of both talked about today, healthy people, healthy ecosystems. We also have a CD here for us. So if any of your questions aren't answered for some reason, or you'd like them answered in more detail, there's probably something in here related to them.
Okay, who's got the microphone? Kaylee, I think there's a couple of questions. It's right up here.
Irene Tinker, University of California, Berkeley, Professor Emerita. In 1988, when the community user forestry groups were set up, they made quite an effort to set up separate ones that were going to be governed by women and separate ones by men. I wondered, what is the current status of that?
Actually, it's a really interesting question. Sometimes it seems some sort of other factors drive for that. If the organizations wants to bring the leadership of women high, therefore they made the women groups, and the result what we observed is that the side streaming women groups are not so active. Therefore nowadays we are trying to develop the leadership of women in the mixed group. If they really can lead the forest user groups, then that leadership will be sustainable. Therefore the trend of making the separate women group is going down, rather than we are trying to develop the leadership of women in the mixed group in the by gender mainstreaming.
And just right next to you there. Wait for the microphone's right behind you there.
I found your model extremely interesting, and I think it bodes very well for the future of community development in Nepal. But I wonder how widespread is the model that you are building? How many communities are actually affected by this?
Actually, we did this project with 82 forest user groups in Dhading districts of Nepal, but we are already working with more than 500 forest user groups in the mid-hills of Dhading. Therefore, we have a very big scope to scale up these model in other forest user groups too.
The reason that I'm so impressed is, of course, the emphasis on integration.
Yeah.
I remember when I was doing research in a small town between Tansin and Pokhara, that the international donors say the Australians were concerned with reforestation.
Yeah.
GTZ was interested in potable water. Somebody, CETA, I think, was interested in trails and bridges and things of this sort. But they insisted on each of them having their user groups in the community. And for the most part, the user groups were so concerned about their particular area that they did not work together. But I'm impressed by the fact that you have been able to accomplish this coordinated activity on the part of the community.
Yeah. Actually, the strength of the community forest user group is this is the resource-based permanent institution in the grassroots level. Other groups are formed in the ad hoc basis. For example, if some donor or some the NGO from the group for the drinking water system or to construct a bridge like that, it would be very much ad hoc. But the forest user groups are the permanent local institutions. Therefore, we are trying to lobbying and advocacy to use these very permanent and very much devolved group, because this is the very good example of devolution, and we can use these groups to do whatever, if any sort of community development activities, conservation activities, and so on. Yeah.
Do you have anything to add to that? No. Okay, I think we're. I guess we have one last question there in the back. I'm sorry, I didn't see you there.
Hi, Laura Iyam. I'm a freelance reporter for 51%. It's a women's radio program. And I'm curious about how controversial was it to come in and talk about family planning in these communities, to bring this up as an issue, and if there were any cultural reservations people had about it, and how did you overcome that? Also, in terms of contraception or family planning, what exactly are you talking about? Are you talking about it's a remote area? If they're talking about condoms, then how do you get the condoms in there? If you're talking about even birth control pills, how are you getting the birth control pills in there? If it's 4 hours to get to a clinic, then how are people getting access to any of these sort of materials for family planning? And also expense, how much do they actually have to pay for this? Is this coming out of their normal budget? And if so, how much do they have to pay for that? And in terms of this other biomass cookers, and I guess in the materials you didn't talk about it specifically, but these solar cookers, and you talked about a better stove, how much does that actually cost a household to get? And if it's going to cost them some money, how do you persuade them to change from what had been a way of life to moving over to this other technology?
Okay. It's a very interesting question because there are so many cultural barriers to talk about the family plannings and family planning contraceptives. Therefore, we developed these PHE outreach workers, the peer educators model, because they are the one to work together and to invest most of the times with their colleagues, and we develop the peer educators, and they are the one for the behavior change communication, and they are the link person with the female community health volunteers. And the government has provided these family planning contraceptives in free of charge. They can get either from there or they can buy in some private suppliers also, but it's quite difficult for the people living in the remote places. And next question about the clean energy. Actually, the community forest user groups have some resources, and they are trying to allocate these resources for the income generating activities of the identified poor, because the each and every community forest user groups have done participatory well-being ranking, not only the wealth ranking, the participatory well-being ranking, and they have identified the poor and ultra poor, and they are trying to leverage the resources for the livelihood improvement of these communities. If the people cannot pay for the improved cook stove, the community forest, some of the community forest user groups have already initiated to pay for them. And we have already developed the improved cook stove promoters. They are the local one. They don't need to pay money. If they cannot pay, they can work for them in lieu of their service. Like that, we are trying to expand our services.
Kara, do you want to mention, or Judy, a little bit more about the...
Just to add to that, I think one of the ways that we found that we could broach these sensitive subjects was bringing in linked messages. So, you talk to somebody about the small area of land that they have and how many children do they want to have, because people in the Terai anyway really know that their resources are limited. As it is, the men have to go to India for a large part of the year to work. And they actually already, if you sit and talk to a group of villages, they don't want to have more than 2 or 3 children. Very often it's 2, but it may be 3 if they've already got 2 girls and they want to try one more time to have a boy. So actually, if you talk to them about the hardship of life and how little land they've got, how squeezed they are, and the sort of precariousness of their lives, you can lead into family planning that way. And you can talk about forest degradation and how they have to walk further and further for firewood and this kind of thing. So it's quite easy to sort of bring in the population concepts that way. Whereas if you just go and talk cold about family planning, no, it's going to be really difficult. Our project, when we started with the Red Cross, there were a lot of sensitive subjects that people wanted to talk about, not just family planning, but sexually transmitted infections and things like this. And so the project actually put up suggestion boxes in the villages so that people could ask for the project to talk about topics when they were doing health camps and they would do these outreach sessions. They could ask anonymously for to cover such and such a subject. And so that helped a lot. But they tell me they don't use the boxes anymore now because actually they've overcome a lot of the stigma. In terms of contraceptives, I think we have pills and condoms are very popular in our area, but we also have pills, and I think we may have injectables as well. We get supplies from the Ministry of Health. We don't create a parallel service, so we get the supplies from the Ministry of Health, but we do hold supplies in the clinic, so that if the CBDs run out or if the government supplies don't reach the CBDs, we can supplement them, but we don't actually buy the contraceptives separately. And then, oh yes, there are referrals. Women who want to have permanent methods, we will refer them to the Ministry of Health facilities. So, thank you.
In addition, another two interventions like the radio programs and the adult the literacy classes among the women and girls. We have incorporated these things in the content of the literacy books, and they can discuss and they can learn from that also.
Okay, great. Well, we've run out of time, and I think we've run out of questions, so it's a happy coincidence. But I thank you all for coming, and please help me in thanking our two speakers.
Thank you all.